I'm gonna not enter my patient's room and provide for privacy. Hi, my name is Brooke. I'm gonna be your nurse today. Can you tell me your name and date of birth? And I'm gonna check their armband to verify their name and date of birth. Do you have any allergies? Okay, my patient doesn't have any allergies. I'm going to explain what I'll be doing today. So I'm going to be hanging a medication that the doctor has ordered as a piggyback, and I'm going to wash my hands. And then I've checked my medication 3 times for the 6 rights of medication administration. I've checked them when the order came through on the MAR, in the medication room when I was pulling the medication, and then at the bedside before I give it. And I'm checking this for the 6 rights, so the right patient, right medication, right dose, right route, right time, right documentation. And so I'm going to grab my medication. I've also made sure that this medication is compatible with what is already running through their primary IV, and it is, so we are good to go. If this was running through a pump, I'm going to scan the bag, scan the patient's armband and the pump into the computer. And then I'm just going to verify my order and my dose and range and the rate that it's supposed to be running at. I'm going to take my medication and my tubing. I'm going to take my secondary tubing out of the package, and I'm going to go ahead and clamp that. I'm going to pull this cap off of the spike and then the cap off of the end of the bag, never touching the ends because they are sterile. And I'm just going to attach that. And then I'm going to hang that. And I'm going to squeeze the chamber about halfway. And then I'm going to prime that. Once I have that primed, I'm just going to hang this up, and I'm going to label it with my name, the date, and time that I set it up. And then I'm going to take the hook that came with the secondary tubing. I'm going to grab my primary line and make sure that that is clamped off. Or if it was running on a pump, I would just pause the pump. So I do have that clamped. I'm just going to hook that so it's hanging lower than the piggyback line. Okay, so once I have that, I'm just going to wash my hands again and put on gloves. I'm going to take an alcohol swab, and I'm going to wipe the port that I'll be using, and I'm using the port that is distal to the patient or above the pump if using a pump. So I'm going to wipe that. Once that's dry, I would take my tubing over my secondary line and attach that to that port. I'm going to unclamp that secondary tubing, and then I'm going to unclamp my primary tubing and verify that that is running now. I'm going to make sure that it's dripping. If it's gravity, I'm going to make sure it's dripping at the rate that it's supposed to. And if it was in the pump, I would just make sure that the pump was running on that medication for the piggyback and at the ordered rate. And then I'm going to assess my patient's IV for any complications, infiltration or inflammation, and make sure that they're not having any reaction to the medication that they're receiving. And yeah. And then to discontinue the piggyback, I would just come back over here. I'm going to roll clamp this or pause my pump. And then I'm going to clamp my secondary tubing. I'm going to unhook my secondary tubing from the primary port. And then I'm just going to take a Kuros cap, and I'm going to first take an alcohol swab and wipe off that port. And then I'm going to take a Kuros cap and apply that to that port while it's not being used. And then I'm just going to restart my primary medication, either just unclamp it or restart the pump on the primary, make sure it's running at the primary rate, and I'm going to raise it back up to normal height on the pole. And then I'm just going to discard of my medication, the secondary tubing, and all of my trash. And then I'm going to take my gloves off, wash my hands, come back over to my patient, make sure they're comfortable, they have their call light, their bed is low and locked, they're comfortable, they don't need anything, they did not have a reaction to the medication, and then I'm going to just document the medication, how the patient reacted to the medication, the time that I gave it, and how their IV site looks.